Asthma. Did you know that up to 90% of pediatric and up to 60% of adult asthma patients have underlying allergic triggers? And children with asthma often have other allergy-related conditions, including food allergies, atopic dermatitis, and allergic rhinitis. Seasonal viral infections increase risk of asthma exacerbations. There is a cyclical seasonal spike to asthma symptoms in both children and adults. There are striking differences in the seasonality of asthma symptoms according to the age of the patient. Children, fall. Back to school time in spring. Adults, winter. Predictable virus seasons warrant proactive care. The combined effect of virus, asthma, and allergies is much worse than any one of these factors on their own, or in combination with one other factor. In fact, compared to non-sensitized children, children with asthma who have underlying allergies have 47% greater chance of symptomatic viral illnesses, almost 50% greater likelihood of moderate to severe asthma symptoms when they have a virus, and overall increase in frequency, duration, and severity of asthma and virus-related symptoms. In addition, food allergy is a major and under-recognized risk factor for severe asthma exacerbations, and people with asthma and food allergy are more likely to have severe asthma exacerbations than asthmatic patients without underlying food allergy. Reducing exposure to allergic triggers dramatically decreases the risk of severe asthma symptoms. Taking steps, such as improving indoor environments by reducing exposure to allergens, can result in as much as a 30% reduction to asthma symptoms, and may also result in an almost 50% reduction in severe asthma exacerbations. In a study, it was shown that exposure reduction resulted in almost 50% fewer asthma exacerbations. NIH guidelines recommend allergy testing to identify allergy triggers as part of a stepwise approach for all patients with persistent asthma. Reducing a patient's exposure to allergens has been shown to be as effective at reducing symptoms as results achieved with pharmacotherapy. Identifying your patient's specific allergic triggers with an allergy blood test, like Immunotherapy, is a necessary step to help reduce exposure to relevant allergens. Immunotherapy-specific IgE blood test measures allergen-specific IgE and aids with the clinical diagnosis of IgE-mediated allergic disorders when used in conjunction with patient history and other clinical findings. Since allergy exacerbations can increase seasonally, testing can help prepare for increased risks and be better prepared to manage exposure reduction. Typically, patients are not monosensitized. Multiple allergens can play a significant role in lower respiratory symptoms. Allergens add up. What may seem like the obvious allergy or asthma trigger may be just one part of the picture. Most people are allergic to more than one thing, and greater exposure to allergy triggers is more likely to make symptoms worse. Once you know your patient's triggers, you can help them reduce exposure to allergens below their threshold, which can help decrease the need or prevent the addition of new medications and stop or reduce symptoms. Help improve your patient's quality of life through better asthma control. Practical indoor intervention strategies in the bedroom results in sustained improvements in symptoms, including 4.4 fewer missed school days per year, and up to 17 fewer days wheezing per year, 7 fewer missed work days per year, and 21.3 fewer symptom days per year. Give your patients with asthma the best management and treatment plan possible with Immunotherapy test results. Develop an action plan for personalized, effective treatment guided by quantitative results. Counsel patients on targeted exposure reduction to specific triggers. Consider referral to an appropriate specialist. Make Immunotherapy-specific IgE blood testing a routine part of your practice. Get started now.